Hi, and welcome to Askimo TV. Talking today to Dr. Feilim Murphy. Dr. Murphy is the clinical lead for pediatric surgery and neurology at St. George's Hospital in London, specializing in undescended testes and incontinence. Hi, Dr. Murphy. How are you?
Fine, thank you very much.
Wonderful. Dr. Murphy, let's talk a little bit today about bedwetting and frequently asked questions that people may have. So what are some of the medical causes for bedwetting?
Well, it's very important to remember that the vast majority of children who wet the bed or have what we use as a technical term, nocturnal enuresis, so wetting at night. This is due to there's nothing majorly wrong with the child. There aren't any huge major medical issues. The vast majority of the time, it can be due to too much fluid being created at night, or in a very simplistic way of thinking about it, that there is a failure of adequate maturation of both the brain and the connections to the bladder, and therefore the need for the child to be awoken at night, or that arousal level is much higher and they don't wake up.
At what age should parents be concerned that their child is still bedwetting, or that they cannot get them out of nappies at night?
Well, very simply, the age that most of us would get properly worried is over the age of 5. Below the age of 5, some children can be quite variable. And in reality, in the Western world, we're now toilet training children a lot later than we used to. And that means that full continence, both day and night, is tending to be achieved a number of years and a number of months later than it was even 5-10 years ago. So really, below the age of 5, you really shouldn't worry too much at all.
What causes a child to be a bedwetter, and could it be hereditary?
Well, children who wet the bed frequently have dysfunctional voiding during the day, so they have an abnormality with actually going to the toilet at regular opportunity during the daytime. They frequently suffer from constipation, and they've also sometimes have gotten to some poor bedtime routines. All these things are very easy to occur in children, and children can frequently fall into, and it's a terrible phrase, bad habits, but it's not their bad habits, it's the routines that they've gotten into. A lot of children are indeed related to parents who are bedwetters or have bedwetted in the past. It's not at all unusual for it to be hereditary, but in reality, these things tend to run in families. Whether or not there's an actual gene or it is related to things from a genomic perception, I think is unlikely. I think a lot of it is to do with if your parents were a bit slower to mature, you're more likely to be slower to mature.
Talk me through some of the various options that parents have for their children that are wetting their beds. So what can be done to help?
Well, the very first thing to remember for both the parent and the child is it's really no one's fault. Okay? The child does not have any conscious understanding of what's going on. And the parent needs to understand that, because it can get extremely frustrating for a parent and for a child that they have recurrent episodes of having accidents despite doing everything normally. So to reassure both the child and the parent that they're both normal and that it's no one's fault is really a key step. The second thing really to look at is to make sure that the appropriate bedtime routine is going into place to ensure that the child is going to toilet at the right time and is actually emptying their bladder in normal fashion. It is not unusual for young girls not to empty the bladder because they're sitting on a toilet that's too high for them. It's not unusual for them to have problems with constipation, which will mean that they're not emptying their bladder normally or well in the times that they're awake. And one of the other key things to remember, particularly at night time, is that frequently these children are fast asleep and have wet the bed, and they have very obvious arousal problems. Lots and lots of parents will know that when their child wets the bed, everybody else in the house will be awake, but the child would still be asleep. That is not the child ignoring the situation. It's simply a brain maturation issue that they are not able to arouse themselves. And a lot of the treatments are aimed at causing that arousal to occur.
Tell me a little bit about using the medicine desmopressin to treat bedwetting, and at what age you would recommend using that medicine.
Well, desmopressin is a very useful medication for treating children with bedwetting. It works as really as hormonal replacement because at night time we all create a hormone which decreases the amount of fluid that we produce because you produce more urine in the day and at the night the body needs to regulate that. So it is very useful for replacing people. And there are a number of patients who have a kind of an inadequacy of that hormone. So it's a wonderful thing. The predominant treatment course of for children with bedwetting, of course, is to use an alarm. So the vast majority of children, particularly up to the age of 7 and beyond, the use of an alarm at night time is extremely successful. So if an alarm isn't useful or hasn't been successful in the child, the use of desmopressin is highly recommended.
Is there any side effects to using the drug? And at what age do you think you would recommend it for a child over 6 or?
Like all these things, if you look at the size of the bottle or the box, it lists off a whole rate of very scary side effects. In reality, desmopressin is a very safe medication, and I wouldn't really have any problems with recommending it. Traditionally and classically, we tend to recommend it for children over the age of 7. There is some evidence that it is used for children less than the age of 7. Once again, I would say that the alarm probably pips it in the general evidence that it is more successful to use the alarm up to children to the age of 7, absolutely. And then after the age of 7, if they're having difficulties, the use of desmopressin is absolutely indicated.
Thank you, Dr. Murphy. Thank you so much for talking to me today.
No problem.